If you follow sports, or really any wellness trends, you've definitely seen them. Those perfect circular marks on the backs and shoulders of athletes. It's called cupping. It's an ancient therapy that's having a huge modern moment. So today, we're going to dive in, peel back the layers, and look at what the science actually says about it. So that's the big question, right? We've all seen the marks, but beyond the tradition, beyond all the celebrity endorsements, is there any real, measurable biological effect happening here? Well, that's what we're here to find out. First off, let's just appreciate that this is not some new fad, not even close. We're talking about a practice that goes back thousands of years. It's in one of the oldest medical texts we know of, the Egyptian Ebers Papyrus. It was used in ancient Greece, and it was a pretty common tool in European medicine all the way into the 19th century, before, modern drugs started to take over. Okay, it's also really important to know there are two main types. You've got dry cupping, that's the one you usually see. Suction pulls the skin up, increases blood flow, and leaves that mark. Then there's wet cupping, which is a bit more invasive. The skin is lightly pricked first, so the suction actually draws out a tiny amount of blood. The studies we're about to look at cover both types, which is pretty interesting. So here's our game plan. First, we're going to look at a clinical trial that tested cupping for knee pain. Then we'll go deeper, like inside the body, to see what might be happening with inflammation. After that, we'll connect the dots and finish up by talking about what the future of this research looks like. All right, first things first, the big what question. Does it even work? To figure that out, we're diving into a study that tested cupping on one of the most common pains people deal with, knee osteoarthritis. So, knee osteoarthritis, or OA. You've probably heard of it. It's basically what happens when that protective cartilage in your knee joint just wears down over time. It is a huge cause of pain and disability all over the world, which actually makes it the perfect condition to test a pain relief therapy on. So, how did they test it? Well, a 2012 German study took 40 patients with knee OA and randomly split them into two groups. Group 1 got 8 sessions of dry cupping over 4 weeks. The other group, the control group, got, nothing. They just went about their lives. And this kind of random setup is really the gold standard for good clinical research. So what happened? Well, check this out. This chart shows something called a WMAC score. It's just a standard way to measure pain and function in arthritis patients. The only thing you need to know is that a lower score is better. And after 4 weeks, wow, look at that difference. The cupping group is down at 27.7, while the control group is way up at 42.2. That is a massive, statistically significant gap. And the results keep coming. This slide looks just at pain intensity, rated on a scale of 0 to 100. And again, same story. The cupping group's average pain was down at 38.4, while the control group was still up at 55. This just adds more weight to the idea that the people getting the therapy were genuinely feeling less pain. So the big takeaway from this first study is pretty straightforward. The patients who got cupping told the researchers they had a lot less pain and that their knees were working better. But that just leads to the next even bigger question. Why? What on earth could be causing that feeling? To answer the how, we got to look under the hood, inside the body. And when it comes to chronic pain, scientists have one major suspect: inflammation. You can think of inflammation as your body's emergency response system. When a joint gets damaged, the body sends out these chemical messengers called cytokines. They're like little alarm signals screaming for the immune system to come help. But the problem with chronic conditions is that sometimes those alarms get stuck in the on position, and that contributes to constant pain. And this brings us right to the idea behind our second study. Researchers in a 2023 paper basically said, hey, we're not exactly sure how cupping works to reduce pain, but a really good guess is that it's turning down those inflammatory alarm signals. So what they decided to measure them. So this study took 93 patients, gave them wet cupping for 6 weeks, and they measured a whole bunch of those cytokine alarm signals in their blood, before and after. And just look at this. This chart shows interleukin-1 beta, one of the main inflammatory culprits. And there it is, a clear, significant drop after the therapy. You can literally see the trend line going down from before to after. And it wasn't just a fluke. Here's the data for interleukin-6, another big player in the inflammation game. And same exact story. A really significant decrease from pre to post-treatment. We're definitely starting to see a pattern here. In fact, the effect was, pretty staggering. The researchers found that more than 10 different pro-inflammatory markers were significantly lower in the patient's blood after those 6 weeks of cupping. So we're not just talking about turning down one or two signals. This looks like a much broader systemic change. Okay, so we've got these two really interesting pieces of the puzzle, right? One study that shows patients feel better, and another one that shows these inflammatory markers actually go down. So let's connect those dots. So here's how it seems to fit together. 1. We see an effect. The 2012 trials showed that patients reported feeling better. 2. We see a potential biological mechanism. The 2023 study showed inflammation markers went down, which leads us to a pretty compelling hypothesis. Maybe cupping helps reduce pain by reducing inflammation. Now wait, before we get too carried away, this is absolutely critical. We have to talk about the limitations here, and both studies are super clear about them. That first knee pain study, it didn't have a placebo group, meaning there was no fake cupping to compare against, so we can't rule out the placebo effect. And the inflammation study wasn't a controlled trial, it was a look back at old records. Plus, we're comparing a dry cupping study to a wet cupping one, so it's really important to remember, this is early research. More is definitely needed. Okay, so where does all of this leave us? What's the real bottom line on the science of cupping, right here, right now? The final takeaway is this. We've got some early and frankly pretty exciting evidence that suggests cupping might actually help with pain. We also have a very plausible reason for how it might work, by reducing inflammation. But the key word in all of this is suggests. To really know for sure, we need bigger, better studies with really convincing placebo controls. And that really leaves us with one last big idea to chew on. We have these ancient practices, like cupping, that have been around for thousands of years, often just dismissed by modern medicine. But what these studies show is that when we point our modern scientific tools at these old techniques, well, sometimes we find there's a lot more going on than we thought. It makes you wonder, what other wisdom from the past is just waiting for us to rediscover?